Welcome to this lesson. This presentation was developed by Mark Duran, Narendra Singh, Tom K. Drzinski and Hazel Clothier. This module will teach them other characteristics of public health surveillance. Slide 2. This session looks at the entire system for surveillance, not just the individual components. We will look at individual components in more detail one by one throughout the DDM course. Slide 3. These are our objectives. Identify surveillance standards for communicable diseases and NCDs. Look at regional, global surveillance players. Recognize what makes a good public health surveillance system. Identify the most common surveillance system mistakes. Link surveillance with action. Slide 4. We will review surveillance standards for communicable diseases and non-communicable diseases. Slide 5. World Health Organization produced recommended surveillance standards in 1999. WHO standards are organized around communicable diseases of interest including eradication, elimination, for reduced incidence or prevalence, for reduced transmission, and that were submitted to international health regulations. It also approached surveillance by syndrome or transmission route. Slide 6. For each disease the standards give recommended ICD code, case definition, recommended surveillance types. Slide 7. WHO also recommends minimum data elements, analyses, presentation and reports. WHO considers principal uses of data for decision-making and some special aspects. Slide 8. Following the political declaration on non-communicable diseases, NCDs, adopted by the UN General Assembly in 2011, WHO developed a global monitoring framework to enable global tracking of progress in preventing and controlling major non-communicable diseases, cardiovascular disease, cancer, chronic lung diseases and diabetes, and their key risk factors. The framework comprises 9 global targets and 25 indicators and will be up for adoption by member states during the World Health Assembly in May 2013. Once adopted, member states are encouraged to consider the development of national NCD targets and indicators building on the global framework. The 9 voluntary global targets are aimed at combating global mortality from the 4 main NCDs, accelerating action against the leading risk factors for NCDs and strengthening national health system responses. The mortality target, a 25% reduction in premature mortality from non-communicable diseases by 2025, has already been adopted by the World Health Assembly in May 2012. These are considered recommended standards for NCDs. Slide 9. Here is the schematic diagram that shows the USOPI NCD surveillance framework, facilitated by POA, but produced by a technical working group in the USOPI. This product was refined through review by regional partners, NCD-related health professional associations in the region, and the POA board. It has been endorsed by the POA board and by the Health Leadership Council, group that represents the 14 health professional associations in the USOPI. A more detailed document discussing the framework and a data dictionary that defines each core indicator is available on www.poa.org. This framework was designed to fit CDC and WHO standards and customized to specific context. It includes school surveys, focus on youth, and a full range of policies, not just best buys. Global monitoring and USOPI surveillance framework use a few core indicators and enable comparisons over time and over place. Surveillance TWG recommendations follow those from WHO discussion papers but went beyond these recommendations to focus on youth. School surveys for NCD risk factors surveillance are attractive because they are cheap and easy to do, compared with house-to-house surveys. Youth risk factors are also leading indicators for NCD trends. If we focus on youth, it will be useful for promoting painful policy changes. Youth are more vulnerable for tobacco, alcohol abuse, or obesity, overweight. WHO does not put as much emphasis on youth surveys for NCD monitoring and surveillance is because many countries outside of the Pacific do not have very high attendance rates at school. What is the problem if attendance rates are low? School attenders are likely to be from the privileged class and may not be representative of entire school-age population. Slide 10. Which are the advantages of using standardized frameworks and collection instruments? Some advantages will be, data definitions and survey questions have already been tested for validity. If it uses the same set of indicators, this would allow comparisons across countries. Often analysis mechanisms are already set up. The use of standardized frameworks and survey instruments addresses many of the surveillance system issues that you will look at in this DDM1 course. Slide 11. We are going to talk about regional and global surveillance players. Slide 12. In the Pacific Public Health Surveillance Network, PPHSN, organizes regional communicable disease surveillance information and capacity building. PPHSN is a joint effort by partners including 22 departments or ministries of health, WHO, SPC, POA, FNU, and CDC. The Pacific Public Health Surveillance Network, PPHSN, is a voluntary network of countries and organizations dedicated to the promotion of public health surveillance and appropriate response to the health challenges. The first priorities of PPHSN are communicable diseases, especially the outbreak-prone ones. At this stage the target diseases include dengue, measles, rubella, influenza, leptospirosis, typhoid fever, cholera and HIV/STIs. Slide 13. The Pacific Monitoring Alliance for Non-Communicable Disease Action, MANA, is a collaborative alliance inclusive of all Pacific Island countries and territories, PICs, networks, agencies, organizations and institutions working to improve the monitoring and surveillance of non-communicable disease across the Pacific region. Coordination team is formed by Secretariat of the Pacific Community, SPC, World Health Organization, POA, the University of Auckland, and Pacific Research Center for the Prevention of Obesity and Non-Communicable Diseases of Fiji National University. Slide 14. The Pacific Health Information Network, PHIN, was established at the Health Metrics Network, HMN, meeting in Noumea in 2006. Since then various workshops and meetings have been held across the Pacific region. PHIN was created to provide a mechanism for networking, support, information sharing and training for people working as health information professionals in the region. The Health Metrics Network, HMN, is the first global partnership dedicated to strengthening national health information systems. HMN operates as a network of global, regional and country partners. As a country-owned and partner-driven platform, it assesses health information systems and sustainably improves them, through the use of the HMN framework. HMN is carrying out work in two technical work streams, called Priority Strategic Initiatives, Move IT for the MDGs, monitoring of vital events, including through innovative approaches, such as information and communication technology, consists of helping countries strengthen their health information systems to help track progress towards the Millennium Development Goals. It is a renewed drive to record every birth, death, and cause of death, reversing the global and national neglect of this issue. Progress Tracking Tool, State of the World's Information Systems for Health. A progress tracking tool is under development to help countries measure health information system improvements. The State of the World Information Systems for Health, SWISH, report will document the current state of health information systems in countries and identify priority areas for strengthening. Slide 15. As no one single agency is responsible for vital statistics and civil registration in the Pacific, the Brisbane Accord Group, BAG, was established to coordinate, facilitate and support investments in health information systems. Slide 16. International health regulations impetus with SARS outbreak in 2007. IHR was legally binding since 2007. The purpose of IHR is to prevent, protect against, control and provide a public health response to the international spread of disease in ways that are commensurate with and restricted to public health risks, and which avoid unnecessary interference with international traffic and trade. IHR is a recognition of the importance of having international agreement and commitment to maintain vigilance for diseases with outbreak potential and reporting promptly and systematically to the international community. Slide 17. Which are your obligations under IHR? To have in place a IHR national focal point. To have the capacity to detect outbreaks and unusual events. Assess the global significance of an event. Notify WHO immediately of the event is of potential international concern. Implement control measures. Request assistance, if necessary. To develop routine and emergency PH response capacities designated international ports of entry. Take all practicable measures consistent with IHR 2005 to monitor and control ship discharges of sewage, refuse, ballast water, and other potentially disease-causing matter which might contaminate waters of a port, river, canal, strait, lake or other international waterway.